Hey, it's Dr. Guy, the Face Guy here. I want to talk to you about. I see people talking about Sculptra, should they not do it, or these energy devices, and they're thinking about surgery and how that might affect results. So I'm just going to give you my take, and as a facial plastic surgeon, and have done plenty of lifts on patients who've had anything and everything under the sun, and how maybe it affected results. So Sculptra is going to be one of your biostimulatory type of injectables. It can be a very nice product. It can do some very nice things when injected into the right plane. But the answer is yes, it can make surgery a little bit more difficult. You're going to have some scar tissue that's going to form where the sculpture is placed. As long as it's just underneath the skin, it's really not going to have a huge impact on your deep plane or lifting in that area. Threads, same type of deal. You're going to get some scar tissue where those threads were. I've been in a face that has had threads recently, and you're having to cut through it, and sometimes that can make it a little bit more difficult and a little bit more nerve-wracking, because sometimes distinguishing between nerves and suture, previous suture, can be a little difficult. But more importantly, I would like to talk about some of the energy devices. So your radio frequency microneedling, these energy-assisted liposuction cannulas, or radio frequency like FaceTite, those things. Typically, when I've been in faces that have had that, there's a lot more scar tissue, but also a lot more destruction of tissue. And some of that tissue is the stuff that we're using to lift, like the platysma or the SMAS. And that, I feel, can affect results more and make it more difficult to do a lift versus somebody who maybe just had Sculptra. Filler, your HA fillers, your hyaluronic acid fillers, I don't think those really make a difference. You get in there and you'll see it, but I don't think that really impacts. So I guess what I'm trying to say is it is fine to have those stuff, and it really can help out some patients, and it might be something that's going to kick the can down the road, maybe get you a few more years before you feel like you're not getting any kind of results out of it, and really you are now a surgical candidate versus one of those gap patients. But I would hesitate on some of the energy devices if they are going deep to the skin, whether or not you want to do that if you think surgery might be in your future. Lasers and the topical stuff, it doesn't affect it at all. I think those are great for resurfacing and can be very complementary to surgical procedures, even if it's something that's just that is the need that you need at that time. It can have some great results. So anyways, I just like to put that information out there so patients might have a little bit more education when it comes to making decisions, whether they want to do something that's going to be semi-permanent or maybe affect surgery that they're thinking about having in the future. You guys have a good day.